Every year, 1 million women are diagnosed with some form of GYN cancer. Why is it important to raise awareness about GYN cancers? A primary reason why GYN cancers are so challenging to beat is because women don't recognize the symptoms. The comprehensive global cancer statistics from the International Agency for Research on Cancer indicate that gynecologic cancers accounted for 19% of the 5.1 million estimated new cancer cases, 2.9 million cancer deaths, and 13 million in a 5-year prevalent cancer cases among women in the world, and that was in 2002. In 2013, people from more than 60 countries and 130 cities came together to raise awareness about this women's cancer. Good evening, ladies and gentlemen. My name is John Crow, the host and the producer. Tonight's program is about cancer beneath the belt, under the waist, from the waist down. Cancers that affect primarily women. So if you have a mother, a sister, a cousin, an aunt, some female friend, I'd encourage you at this point in time to call them up and have them tune in to this program. I have two ladies here with me who are going to help me understand, and hopefully those of you watching, what we're talking about in terms of these different cancers. I mean, we know a lot about breast cancer, those of you who like talking about those things. We know about throat cancer. Men got prostate. You got something under the arm, I forget what they call it, some kind of funny name, medical name, under the arm cancers. All kinds of different cancers that we have and we hear about. But now, a lot of women, like the numbers I just quoted for you, we're talking about cancers in the uterus, cancers in the, how do you call it?
Cervix.
Cervix, and all kinds of different kind of cancers. Let me not hold you in suspense. Tonight I have Jennifer Morgan Petgrave here. And Jennifer is a Jamaican lady. She tells me she's a health coach, and she's the CEO and owner of the Olives Wellness Center somewhere out in New Rochelle. And she is here tonight with us at Caribbean Classroom. Welcome to Caribbean Classroom.
John, my pleasure.
All right. Along with Jennifer, I have a young lady, beautiful lady, very quiet, very subtle, but very, very powerful. Her name is Yvonne Rubie, and Yvonne is a member of the House of the Lord Church, and she told me that she's in charge of the public health ministry at the church. And tell you, that lady, she might be small, but you say the small, but the talawa.
Pleasure to be here. Thank you.
Welcome to Caribbean Classroom.
Thank you.
Okay, let's jump off this thing. First of all, GLobeAthon. The opening picture that I had said GLobeAthon.
Right.
Cancer, something cancer.
Gynecologic cancers. Yeah.
Okay, talk to me about GLobeAthon first of all.
Okay. Well, here it is. Let's start from where GLobeAthon began.
Okay.
All right. So in 2012, 52 gynecologic oncologists, doctors, got together, and they walked around the White House. They did this for 72 hours.
White House in
the U.S. And they did it to bring awareness to these gynecologic cancers.
Why? What prompted them to do that?
Well, because that's their area, that's their field.
Washington.
The area, what prompted them to do what now?
To do walk around the White House.
Oh, because that's, you know, the seat, exactly, that's the seat of power. It is the seat of power, isn't it, here in the United States?
Yeah.
President.
Exactly, so it made sense.
That's the best place to make a statement.
Exactly, exactly.
And they didn't arrest them for trying to...
No, they didn't. But
they walked around the White House?
Yes, for 72 hours.
These are gynecologists?
Yes.
Yes, gynecologic oncologists.
Oncologists, okay.
Yes, so they're dealing with the cancers. And so they've looked, we can make the assumption clearly that they've all looked at the research and they saw what was happening around the world in terms of these cancers below the belt. And so that was a major coming together for them. Once that was done, then it moved into then 2013, which then it just exploded into an international cause right, to promote the awareness of gynecologic cancers around the world.
Because it's not just a U.S. problem.
Exactly. It's through
International.
the entire world. It doesn't matter, all women, it doesn't matter what our religious beliefs, it doesn't matter what our political stance is, it doesn't matter about our culture, any of those things. Cancer is no respecter of person. It will attack you. It can attack you, right? Not that it will, but it can attack you. So we want to, GLobeAthon wants to make sure that this information gets out across the world because it's affecting women across the world. All right? So that was one of their main purposes.
So, okay, so after the walk, so this guy, female and male, I take it are all women.
I just know that they were gynecologic oncologists, and that was what was
And so then they decided to
important
walk
thing.
around the White House on a Sunday afternoon, I guess. You know,
Well, let's
nothing
go
else
with
to
that.
do, or something to that effect.
Yeah.
But now the whole idea is something prompted them to decide that they want to do that. Jennifer, you call yourself as a health coach. Where does diet play into attack these cancers? You use the word, the cancer will attack you. Where does diet play into that?
Well, if you go to the World Health Organization, you know, they link cancer, obesity, to cancer, in particular female cancers. And of course, life, it's not just about diet, it's about balance, balancing your life, your lifestyle, change your lifestyle and balance everything that you put in your body, your food you eat. You know, it's very, very important. It is nutrition, it is exercise, it is attitude, it is rest, you know.
Sleep.
Right, you know.
My wife went to the eye specialist a couple of weeks ago, months ago, and she wanted glasses. And he said to her, you don't need glasses, what you need is sleep. You know, nothing is wrong with your eye. What you need is sleep. So is that what are you saying?
Rest, yes.
Rest.
But yeah, that is very important. But diet, nutrition, and exercise is very, very important. It has been proven to be linked to cancers. So, you know.
Being aware of the foods. Okay, let's get back to GLobeAthon. I want to go back to this name GLobeAthon. How we come up with GLobeAthon? Because GLobeAthon doesn't suggest cancer.
Global, international.
Exactly.
It's an international movement. It's the first international movement that brings together countries all over the world to create this awareness.
Exactly.
You know, to make noise.
But we
to
already have the
talk.
American Cancer Society. Why do we need GLobeAthon?
Yes, but this is countries joining hands together globally, you know, with one voice, one mission, because making noise. And the more noise you make, the more people will listen. The more you'll get your message across to the women, to governments, you know. You can get funding that way for research, you know, and for healthcare. So the more countries that join this movement is the louder the voice, the louder the noise.
Do we need countries or do we need people?
Well, country, the people in the countries.
Exactly.
People in the country.
And also, I wanted to point out that with GLobeAthon, the main emphasis is on awareness and, of course, early detection. It is strictly about that, right? And working with other organizations. Now, most of the other entities, like you mentioned one already, they're doing a lot of research and so forth, and so they're raising funds. GLobeAthon doesn't look about raising funds. That is not what it's about.
Okay.
It's about building awareness and taking it to the grassroots where women, each woman, can identify with what is being said and pass it on to another woman and to help herself as well.
So that's a good segue as we talk about the women. And we have a chart. If you could identify, pick up, you could, I think you could lift it, I think it's heavy. And if you could identify for the camera, those cancers that are prevalent in and around this very, very strategic area of the human body, I call it.
Okay.
Very prevalent, because that's where both, life starts there.
This is true. This is true.
Absolutely, right?
So yeah, so it's all of what you see here. So basically, you're talking about cancer of the ovaries, right? Ovarian cancer.
Ovarian
So
cancer.
the ovaries are there. You're talking about the uterus, which is uterine cancer.
Uterine
right?
cancer.
Uterine cancer, yes. You're talking about the cervix, cervical cancer. Right? I mean, vaginal cancer, vulva cancer. So pretty much everything you see named here, there is a cancer that can invade the area. I mean, it's pervasive. It's kind of hard to digest that, but it is true.
And they're all below the belt.
All below, exactly.
And in that crucial area, why that?
We don't know why.
Why that area?
We don't know, but isn't that fascinating, though? You know?
Because that's where all the fun is.
Oh my! Well, that's
where the babies come through.
Yes, yes. Anyway, so yes, so this is where it takes
I'm not trying to make light of it.
No, I understand.
I am dead serious.
Humor is wonderful, and when we put humor to just about anything, it helps it to go down better, right?
I hope so.
Yes, yes.
So the fallopian tubes affected.
Well, you know, you're talking about the ovaries, right? Yes. So the ovaries, you're talking about the uterus, right, for you with uterine cancer, or uterine cancer, sometimes called endometrial cancer, cervical cancer, a big one for the Caribbean, vaginal cancer, and vulva cancer. Yeah.
I do.
Okay, sex. Since we're talking about that sexy area.
Yes, very sexy area.
Very sexy area. How, those of us who have sex, quite a few of us do, is there anything we should be doing differently? Is there anything that we should be aware of as a man, that I'm going to have sex with a female? What is it that I need to be aware of that I'm passing on? Is it something that is passed on to your partner via sexual intercourse?
Yes. So, well, as far as cervical cancer is concerned, which is mainly governed by HPV
virus.
Human
HPV.
Yes, human papilloma virus.
HPV, break it down.
Human papilloma virus.
It's very easy for you to say. Papilloma, all right.
Yes, the human papilloma
virus.
There are many different types of human papilloma virus. There may be over 30, maybe even more than that, right? But there are several that are specific and can cause cervical cancer and other cancers as well. It's engaged in the vaginal cancer as well as vulva cancer. In the Caribbean, type 16 and 18 are the main types that we find in the Caribbean area, and that account for the cervical cancer. So you're talking about men may do get HPV. There is no test at the moment for them, but they're carriers. Right, and so are women. So it is in the area of contact. Oftentimes you don't even need to have necessarily sex per se, but it's the contact, because if the person has it, right? But if we can, John, I'd like to just reel back a minute.
Come back.
Yeah, reel and come again.
This is your show.
Yes, I wanted to reel it back a minute and come back to what is, just the global aspect of this GLobeAthon component first, because once we get people to go on the website, once we are involved with activities that are taking place, you will learn all of this information.
So go to the website, tell them the website.
Right, so the website is GLobeAthon, G-L-O-B-E, as in globe, and then A-T-H-O-N, all one word, GLobeAthon.com. Right. So I invite your audience to go on the website for several reasons. One, for September, we're calling it Step-tember, where a woman can sign on and pledge to walk 10,000 steps each day. Now, the average person walks anywhere from 5,000 to 8,000 steps a day, so to take it up to 10,000 is really not that difficult to do. And in so doing, there's several things that are accomplished. One, you are doing this with women around the world, taking these steps each and every day. It's called Step-tember. Exactly.
Step-tember.
But you can go on now
and pledge.
It's a pledge.
Exactly.
You're
can pledge to take those 10,000
yes,
steps.
there's no money.
September 10th.
Yes.
No,
You can
it's
go
right
to the
now.
website
It's
now.
right now.
Oh, right now?
Yes.
Right now.
Yes, we want people to, we're inviting people to go to the website and make that pledge to do the 10,000 steps daily. And you can do that for yourself, and you can do that as part of a united effort.
Exactly, with your friends and so forth.
Okay.
You know? So what that means is now when you do the September, you're really doing this with a whole bunch of women around the world.
Because the same thing
Exactly.
is happening on the same
Yes.
day.
Exactly.
Definitely.
Every day. Once you
Every
get
day.
on it,
Yeah.
every day up until the day of the actual main event, you know, we're going to be doing September,
Okay.
right?
And
Even though it's, yeah.
And
Go
it's
ahead.
about part of your exercise regime. You know, you're
Yes.
going to be exercising, so you're benefiting
Exactly.
health-wise from just
Exactly.
doing those steps.
Exactly.
So, but nowadays,
Exactly.
one thing, your smartphone is count how many steps you're walking.
Yeah.
There are apps for that,
Right.
absolutely,
Some people could know that.
absolutely. So then what
Definitely.
I also wanted to go back to then is, so we know that in 2013, as you had said before, that there were 60 countries involved, 130 cities.
Right.
So now for 2014, what we're looking at is over 100 countries around the world that are going to be participating.
Okay.
And this includes Caribbean nations as well. And that's really important.
Yes.
First of all, we want to encourage all the Caribbean countries to participate. You know, it's
Absolutely.
very important. And it doesn't matter how many people turn out on the date. And we need to go back. We have this one thing new that is happening in 2014 is we have 4 different dates for the event. September 7th is going to be for the North and South Americas. September,
7th.
yes. The 14th, Africa and the Middle East. The 21st will be Europe.
Wait, you're going too fast. Okay, 9/7 going to be who?
The 7th is North and South America.
Which includes the Caribbean, right?
North and South America, okay. And the
On the
Caribbean.
14th, it's Africa and the Middle East.
Africa and the Middle East.
The 21st is Europe and North Asia.
Europe
And North Asia.
and North Asia.
And on September 28th, it's East Asia and Asia Pacific.
Oy. East Asia
And Asia Pacific.
and Asia Pacific. Okay.
So we're encouraging our Caribbean sisters and brothers and mothers and fathers to come out on the 7th of September. You know, we
Is there a
still,
location that are you, wherever
different
you are?
countries, you can have it, you know, some countries are having their event in parks, some are going on walks.
Okay, we're in Queens,
Yes.
and we also in Brooklyn. So Brooklyn and Queens go meet where for this walk on the which is that's on this Africa and the Middle East, North and South America, the 7th.
Well, this is why this is so important that being here on your show this evening, we want to encourage churches, organizations, anyone can start an event on that
Exactly,
day.
exactly.
And we still need events in New York, more events in New
Okay,
York.
give the because you could tell on the website, you could say who is what and where is who, yes?
We can do for Caribbean countries.
Right.
Okay.
We know the Caribbean countries, which
Right.
Jennifer will tell you.
Trinidad and Tobago. The contact persons in Trinidad is Karen Dionorine and Sean Dionorine, and their walk will be, they're leaving from Pillars of Harmony on Aripita Avenue, 80 Aripita Avenue
In Port of Spain.
in Port of Spain.
Yes. Woodbrook.
And they're having a whole day event, right? And they're going to Woodbrook, right, Woodbrook. For Jamaica, it's going to be at Emancipation Park. And that is starting at 9 a.m. The contact person in Jamaica is Pat Garrell. And it's pmgarrell@yahoo.com. But if you go to the website and you put in the country, you can get all the information.
Okay.
And we are in Barbados. Dr. Vikash Chaturani is the key person there. Their event starts at 4 p.m. And they're going to have a walk and a run starting at the Bay Street Esplanade.
Esplanade.
That's right. Thank you. Grenada. I see you know about Barbados. Grenada, Caracou, and the Petite Martinique.
Excuse me.
Oh boy,
The contacts.
touchy area.
You have to say it right. It's Carriacou.
Carriacou.
And P.T. Martinique.
P.T. Martinique.
Martinique.
There's an accent.
Yeah.
P.T. Martinique. Okay.
Carriacou.
Carriacou.
Carriacou. Yes.
Okay.
That's where I come from.
Okay. Okay.
Say it right.
All right.
Well, I'm going to interrupt you as far as that's concerned, because one of the major things that I want to point out in terms of Grenada, Carriacou, and Petit Martinique is that the Right Honorable Keith Mitchell, your Prime Minister, Doctor, yes, participated
in the
last year in the walk. He was the only head of state to participate in that walk. And so it really shows the commitment. That's the kind of commitment we're, hoping to have from everyone. That shows a major amount of commitment. He's very, very health conscious, really putting out that, he is in fact probably more than likely the healthiest Prime Minister in the Caribbean. Yes, absolutely, absolutely. So, that was really an outstanding thing to have happen, right? Yes, I'm sorry, go ahead.
Right, and so St. Martin, they're partnering and holding a bike walkathon event.
A bikeathon and a walkathon.
A bike and a walkathon, both, right. St. Vincent and the Grenadines, the contact person is Maggie Gardner. She's based in Connecticut, and she's spearheading a walk in St. Vincent and the Grenadines. So there are still countries that...
so I haven't seen St. Lucia.
Right.
Right? I haven't seen Dominica. All right. I haven't seen Guyana. Nobody from GT. I didn't see anybody from Martinique or Antigua. Right.
So the invitation is open. It can be a walk, it can be a run, it can be dancing,
right, yoga.
It can be yoga. It could be Zumba, whatever you want.
Zumba.
Some kind of movement.
Yes, it can be even a panel.
It could be a cookout.
It could be a panel discussion.
But even when you do the walking and the running or the biking, etc., right? You still want to have that awareness while you're doing it.
It's very important.
Exactly. And so it's this walking or running or cooking or dancing
whatever,
is to bring people in,
together.
To bring people together. But you will still be sharing information. There will be doctors on hand. There will be information, literature that will be given out to begin to build on the awareness for people. And so that's what's so very important.
And we're going to be capturing the, the event, whatever happens.
No, back home, Queens, Brooklyn, New York City.
We are calling, we're encouraging.
Where are we congregating?
Yes.
When we congregating?
We're encouraging, people from Queens, groups, persons, individuals. Just go on the website, GLobeAthon.com, and just click on Start an Event or Host an Event.
Exactly.
And all the information is there that they can download. They can, we are here to guide them, support them, and, we're more than happy to do that. So we're really encouraging every Caribbean country to participate.
You're looking at, I know the netball season is winding down in Brooklyn, as well as the soccer season. They had I think on the 24th or whatever, they're gonna have a Caribbean Cup tournament among the netball players. You used to play netball in your day? No? No? No, from Jamaica don't play netball.
We played. I didn't play professionally, but everyone played.
In high school,
you had to play,
but not professionally.
But no, I mean, them in Brooklyn, they're not professional. Yeah, some people, some of the women, and they look like, I mean, anyway.
Okay.
I mean, very, very well, shapely and all that stuff. But they're playing, things dragging out behind them.
Which is wonderful. It's healthy to be exercising.
Exactly. So I brought that up as an organized group of individuals where plugging into them and their activities can also help.
We can work with them to get them started.
So have you? Okay, we're doing the program now. What other outlets or areas? And I ain't forget the sex part yet and the HPV part yet. Have you been reaching out to people in the circle, so to speak?
We're on Facebook, all the social media, Twitter, Instagram, the newspapers. As a matter of fact, Street Hype, they are excited to support us, and they're encouraging us to do something here in New York. They Jamaican newspapers, and in the different countries, I know most of the newspapers are on board, to support them, to support the cause.
Helping to spread the word.
Right, definitely.
Okay, back to the specifics now. Because see,
you're talking about the specifics of the health
specifics of the cancers, because I don't. Until now, until Dr. Our friend McIntosh, until she raised this issue with me, I never ever thought about this. I never thought about women and the cancers. You know, breast cancer, yes. You hear about the other incidentals and so forth, but never so specific in terms of the below the belt cancer, you know, in that kind of a way.
Well, it's interesting that I'm glad that you brought up her name, because she is on the advising committee for GLobeAthon. And she is in charge of, she oversees what is going on in the Caribbean in terms of promoting GLobeAthon events there. So that's very, very important to make note of. I know you do want to discuss this, but there's also other kinds of, you know, additional, but we can go over that, you know, afterwards.
No, go ahead.
Okay.
What I want to mention, John, is people don't talk about these cancers.
No,
people talk about, they talk about breast. It's like taboo to speak about, you know, these cancers below the belt.
Exactly.
And so, you know, on missions that I've been on, women will come to you and they're whispering that they have these symptoms, but they're whispering, you know, because they're ashamed to talk about it. And because of that, we are losing so many of our sisters and our mothers. Because they're diagnosed in the late stage. For example, I lost 2 friends in 1 year, professional women, in 1 year because of these.
Say intelligent.
I can say professional women.
No,
you know,
we're not saying no. I said that to say.
Yes.
A lot of quote unquote intelligent people who have sense. And who know and read book, okay, study, and have certain symptoms, changes to their body, and they don't want to discuss with anybody.
And one thing we find also, people are just too busy. They put off taking care of their health, doing their tests, going to their doctors. I can do this next year, but I must go to work tomorrow. I must go to this party, but I can put off my health care for a few months. And that is why we're having so many people being diagnosed late.
Women do to themselves as how men do to themselves. A man would spend 12 hours polishing his car. And shining the rims and tires and the booms and make sure the base is right in the car and do all of that. Right? The woman now, she go and she spend 3 days in the hair salon to get the hair right, and to get the makeup and to get the nails have to be just right. But then say, well, listen, when is the last time you had a checkup? From the neck down, or from the neck up, you know, or when is the last time you went and have your PSA test done for the men and so forth? We don't do that, and we don't talk the language around the dinner table. How can we change it?